due to the increased usage of drug and substance abuse in primary schools in Kenya. KIPPRA, in partnership with NACADA, has launched a survey report on the drug and substance abuse to create awareness among the youth.
Drug use and substance abuse exposes the users to high levels of poverty, health and social risks such as HIV, AIDS and crime, while depriving them from opportunities and mechanisms to participate in the country's development processes. As a result, they become an obstacle to the achievement of development goals in Kenya. The Ministry of Education and the Kenya Institute of Curriculum Development has integrated drug use and substance abuse education components into the existing school curriculum and school extracurricular activities as well, such as the drama festival, music, physical education and sports. In addition, through the Ministry of Education, the government encourages the provision of guidance and counseling services in schools to help curb drug abuse and other problems among learners.
The government of Kenya recognizes that alcohol and drug abuse is the biggest threat and an impediment towards the realization of any development agenda, security and health status of this nation. I wish to state that the government is committed to this fight, and it shall not waver under the pressure of alcohol and drug merchants. Further, my ministry has been coordinating multi-agency crackdowns across the country to weed out unscrupulous businesses, counterfeits, and illicit alcohol and drugs in the market. Ladies and gentlemen, allow me to address the reason we are gathered here today to launch the findings of the report of the status of drugs and substance abuse in our primary schools in Kenya. The findings of this study indicate that 20.2% of primary school pupils have ever used at least one drug or substance of abuse in their lifetime. It is worth noting that prescription drugs are becoming popular among the young people, with 10.4% of pupils having never used them in their lifetime. It is shocking to note that the average lowest age of onset drugs and substance abuse is 4 years, and the median age of initiation is 11 years. This trend is a great concern, and it is detrimental to the future of our nation. According to the report, 29% of the people get drugs from shops or kiosks near their schools, 26% from bars near schools, and 14% from school workers. The report also cites that people who accompany their parents to premises where alcohol or drug is served were most likely to use drugs or substance of abuse. The entertainment world continues to glorify alcohol and drug abuse, contributing to curiosity among our children, which leads to experimentation. In the light of this, parents need to be aware of what their children are watching and listening to. I urge my colleagues at the Ministry of Education to direct all their students suffering from alcohol and drug addiction-related disorders to seek treatment from our hospitals and NHIF accredited rehabilitation centers under the Education Afya program. In support of NACADA's work, through my ministry, we shall reach out to the Ministry of Education to support the following school-based program. 1, facilitating the implementation of evidence-based school programs on drugs and substance abuse. 2, development and implementation of drugs and substance abuse policies in all institutions of learning. 3, capacity building of guidance and counseling teachers on drugs and substance abuse prevention and management. 4, review of the teachers' training curriculum to incorporate drugs and substance abuse prevention and management. And finally, development and implementation of life skills programs in schools. With these remarks, I now wish to preside over the launch of the report on the status of drugs and substance abuse among pupils in primary schools in Kenya, and invite Professor George Maua or his representative to officially receive the report.
Where is the launch?
Thank you very much.